Welcome to Whole Life Wisdom, where we explore the interconnected aspects of physical, psychological, and spiritual well-being. I'm your host, and today we're diving into some important research about health trends affecting young adults in our post-pandemic world. Let's look at what the data tells us, and more importantly, what we can do about it. Heightened death rates during the COVID-19 pandemic intensified an already negative trend for early adults, which began around 2010. As a result, early adult death rates in 2023 were about 70% higher than they might have been if death rates had not begun to rise about a decade before the pandemic. The researchers analyzed death rates between 1999 and 2023. Published in JAMA Network Open, the study found, for early adults there was a large jump in the death rate between 2019 and 2021, which are considered the core pandemic years. In 2023, the death rate remained nearly 20% higher than in 2019. Drug-related deaths are the single largest cause of 2023 excess mortality, compared with the mortality that would have been expected had earlier trends continued. Other important contributing causes were a variety of natural causes, including cardiometabolic and nutritional causes, and a variety of other external causes, including transport deaths. The rise in opiate deaths has been devastating for Americans in early and middle adulthood. What we didn't expect is how many different causes of death have really grown for these early adults. It's drug and alcohol deaths, but it's also car collisions, it's circulatory and metabolic diseases, causes that are very different from each other. That tells us this isn't one simple problem to fix, but something broader. Our findings underscore the urgent need for comprehensive policies to address the structural factors driving worsening health among recent generations of young adults, said study co-author Andrew Stokes, Associate Professor of Global Health at BUSEPCH. Solutions may include expanding access to nutritious foods, strengthening social services, and increasing regulation of industries that affect public health. Future research will explore ongoing consequences of the COVID-19 pandemic and the trends that were already in place when it began. Additional news regarding heart deaths as they continue to surge among COVID inoculation. A group of leading scientists has issued a red alert as heart failure, cardiac arrests, and related sudden deaths are continuing to surge among healthy young people who received COVID mRNA vaccines. The Canadian medical experts are demanding action as spikes in heart deaths are simply being flagged as unexplained. Alarmingly, the phenomenon is continuing to soar 4 years after the COVID mRNA injections were first rolled out for public use in early 2021. Yet, despite drastically declining uptake for the vaccines over the last couple of years, deadly heart failure is still raging among the vaccinated, long after they received their last shots. Top researchers from British Columbia are warning that the issue remains underdocumented because they say studies have been too narrow and haven't looked at the risk of these injuries months and years after receiving the shot. COVID mRNA shots have been shown to cause myocarditis, inflammation of the heart muscle, and pericarditis, inflammation of the sac-like lining surrounding the heart. Myocarditis and pericarditis can often be symptomless but can lead to sudden death if not diagnosed, leading to the conditions being dubbed a silent killer. A major 2021 study in Israel put the rate at 1 in 50,000. However, many other studies have conflicted with this finding, arguing that heart failure is surging among the COVID vaccinated. Researchers from British Columbia warn those studies that claim the risk is low have been inconsistent in how they classify post-vaccine myocarditis and pericarditis. They are using different time frames to define if the conditions were directly linked to the shots. They are calling for further research, noting that rates of heart failure cases globally have increased nearly 40% since the vaccines were rolled out in 2021. But they also concede COVID itself has been shown to cause heart damage, which confuses the issue even more. They wrote in the medical journal JAMA, future studies on myocarditis and pericarditis related to COVID-19 vaccination should adopt broader diagnostic criteria, include both conditions as key outcomes, and explore the combined effects of infection and vaccination on cardiovascular health. CDC data shows post-vaccine myocarditis and pericarditis are two of the few well-established side effects of COVID vaccination. While these findings may seem concerning, they also highlight opportunities for positive change. Remember, balance is key. Stay informed, but also stay hopeful. Small changes in our daily lives can create ripples of positive impact in our communities. If you found this information valuable, please like and subscribe to Whole Life Wisdom. As we always say, life's dirt roads may be rough, but the scenery is great. There's something good in it all. Enjoy the ride.